My name is Donna Hartman, AKA Jim Scott's wife. Jim Scott was on Cincinnati morning radio for 50 years. Jim loved Cincinnati, and Cincinnati loved Jim back. In the fall of 2020, Jim was feeling weakness in his right arm and hand. He had had polio as a child, and it was that same arm that was affected. His primary care doctor said, I'm going to send you over to UC's Gardner Neuroscience Institute for some testing. About 2 weeks later, we were referred to Dr. Robert Neel. Dr. Neel said, this is ALS. For about 2 years, we continued to play and hike in our woods and do the farm work. Then late October of 2023, literally overnight, Jim's ALS went over the cliff because it turned out that he had ALS-related pneumonia. So then he came to UC Hospital. He was in neurological ICU, and Dr. Neel was there. In March 24, Jim was the Grand Marshal of the Findlay Market opening day parade, and that was scary because there were about 3 months leading up to that, and every day I thought, how are we going to do this? I texted Dr. Neel about 3 days before and said, I know this is last minute, but would you ride in the back of the big 1963 Bonneville convertible with me, with Jim in the front seat? Dr. Neel texted me right back and said, LOL, I'd be honored. And I said, well, are you taking the day off? And he said, I had already planned to take the day off. From the best I could figure, I think Dr. Neel was going to be there and walk the sidewalk to make sure Jim was going to be okay. That's the kind of care that Dr. Neel gives. He was always there. Jim passed in June 24. Jim met ALS with such courage and grace. We are so lucky in Cincinnati to have UC's neurological care, a specialty in one building. And then within that building, doctors that specialize in different neurological issues. Why would we go anywhere else? It was a no-brainer. There's a lot of ways that people can, through philanthropies, support medical causes. What we experienced in Jim's illness was, we know this is fatal. We want to live the best we can until that happens. And that, to me, is clinical support. It's being looked at and being tested. And it can be the simplest mobility things, and we didn't know about them until we went to the UC clinics. And that's my interest, so that other people get the level of support we did, and then some. The Gardner Neuroscience Institute was there for Jim and I. Really, for everybody who gave to UC, thank you.